half hour with a health alert. Area doctors are seeing a lot of patients with flu-like symptoms.
Yeah, take a look at this map from the CDC. You can see Texas is highlighted in bright red at the bottom of the screen there. That means high flu activity. And just over the state line in Louisiana, the level is very high. Our Ron Everett talked to a local doctor and joins us now with what you need to know to keep yourself and your family healthy.
With so many illnesses on the rise, there are telltale symptoms to be aware of this time of year.
Yeah, they can start off with having just mild cold-like symptoms, which is like cough, congestion. They don't necessarily have to have fever, but if they do have fever, usually they could have body aches, some sore throat, nausea, vomiting, and maybe diarrhea.
Dr. Jenny Zhang with UT Health East Texas says if you experience any of those symptoms, you should get tested for RSV, flu, and COVID. Not only is it important to be aware of the symptoms, but you also need to know how these viruses spread.
Sometimes it's through air droplets and then contact with other objects as well.
To protect yourself, pharmacist Sean Sams recommends vitamin D, C, and zinc. And if you do get sick, take precautions to protect those around you.
You're just going to have to work very hard to practice good hygiene, washing your hands, covering your mouth when you sneeze with your elbow, trying to not get into small spaces with a lot of people.
And if you're headed to the drugstore for over-the-counter cold meds, you might see some pretty empty shelves.
In the last probably 6 months or so, we've experienced a lot of shortage of over-the-counter items and prescription items both.
Remember that if you do feel sick, do not go to work and self-quarantine and wear a mask. In Bullard and Longview, reporting for CBS 19, I'm Ron Everett.